Hi, so we're on chapter 17, which covers disorders commonly seen in children and adolescents. We have covered depressive disorders, anxiety disorders, and bipolar disorders in the previous chapters. It turns out that children and adolescents can be diagnosed with those disorders as well. There is a fairly significant increase in the diagnoses of anxiety disorders and depression that we see in adolescents, especially among teenage girls. Okay, so it's not very common that children receive a diagnosis of, let's say, a depression or anxiety disorder. Even though it does happen, it's more common in adolescence and in adulthood. One new diagnosis that has been added to the recent edition of the DSM, the DSM-5, is called disruptive mood dysregulation disorder, which is a depressive disorder that is characterized by frequent and intense angry outbursts that typically happen in multiple settings, such as home and school, or when people are out with their children, etc. And this disorder really allows the diagnosis of a depressive disorder in children or adolescents who express or display their emotional distress and depression through irritability and angry outbursts. It can happen, it does happen in a number of children. I am going to shift gears and spend the rest of the time on discussing briefly two neurodevelopmental disorders. The first will be ADHD and then autism spectrum disorder. So ADHD stands for Attention Deficit Hyperactivity Disorder. It is a disorder that is neurodevelopmental, meaning that a person who gets this diagnosis needs to show signs and symptoms by the time they're 12 years old. Typically, we see the signs and symptoms earlier than that, but the 12 years are the mark in the DSM-5. There are different subtypes. Some people have predominantly inattentive subtype, which would be characterized by problems with focusing, sustaining attention, forgetfulness, misplacing objects, dreaminess or daydreaming, etc. The second subtype is called hyperactive subtype or predominantly hyperactive subtype. That is a subtype where people have more symptoms of hyperactivity and or impulsivity. They're sort of on the go. They have a difficult time slowing down. They can be very unable to just stay seated for more than 5 or 10 minutes at a time. They're fidgety and restless. Sometimes interrupt conversations, complete people's sentences, speak out of turn, etc. And finally, the third subtype is the combined subtype, where people have symptoms both of inattention and hyperactivity, impulsivity. The most effective treatments for ADHD include medication and psychotherapy. Psychotherapy is always recommended in addition to medication treatment because it is through psychotherapy that people can learn how to manage and influence some of their symptoms in a longer lasting way. So the type of therapy most commonly used is cognitive behavioral therapy that is specifically designed for ADHD. Typically, there is a very strong component of behavioral management. Parents need to be trained how to help children regulate their attention and behaviors at home. Typically, there are sort of parent management training programs where parents go in just like into school and they learn techniques and strategies in terms of how to help their children manage their behaviors and attention. One very common behavioral interventions is use token economy. There's a lot of reinforcement, a lot of catching children when they do something right, rewarding them, strengthening those positive behaviors. Tokens are a good system for slightly older children, where every time they do something they're supposed to do, such as brush their teeth when they're supposed to, go to bed or do their homework, they get a token, and for a certain number of token, they can get a little bit of cash or ice cream or some kind of reward, or maybe electronics time, something they find rewarding and enjoyable, and that motivates them to engage in the behaviors that help them succeed in life. I also briefly want to address autism spectrum disorder, which is also neurodevelopmental. It is a disorder that's characterized primarily by difficulties in social interactions that typically include both verbal and nonverbal. Typically, people with autism can have fairly noticeable difficulties with reciprocal interaction. They don't necessarily gesture to the same degree or in the same way as children who don't have autism do. You would need to see a number of different symptoms in order for this diagnosis to be assigned. I want to highlight that autism spectrum disorder is a spectrum. Okay, what that means is, on one end of the spectrum, you can have people who have functioned relatively well, who have achieved great success in life, who are married, who have a career that's fulfilling, and overall do well in life, even though they might struggle with their interpersonal life and situations that require social skills. And on the other end of the spectrum, you can have a person who has never developed verbal skills, who is unable to speak and needs to use augmented communication devices, a person who may not be able to function independently, etc. Okay. The treatment for children with autism spectrum disorder typically involves behavioral techniques or treatments. One such is called applied behavioral analysis, or ABA, which really targets certain goals. Okay, so there would be certain skills that would be developed for the child to master, and then the child would be rewarded step by step as they are approaching the mastery of those skills. Okay, it can be a fairly effective approach, and it should be started early. So when a child is diagnosed with autism, preferably by the time they're 3 or 4 years old, they should be receiving behavioral treatments. Okay, so I'll pause here. Thank you for your attention, and I will see you next time. Bye.